Have you ever wondered how the heart and lungs work together to keep us alive? But what happens when this collaboration is disrupted by a condition called a pulmonary shunt? Picture this, a detour in the circulation highway where blood bypasses the lungs' oxygen station. In this episode, we'll explore the causes, symptoms, diagnosis, and management of this complex condition known as a pulmonary shunt. As we start this journey, remember, knowledge is power, especially when it comes to our health. So, what is a pulmonary shunt exactly? Let's break it down. Imagine the heart and lungs as a team where the heart pumps blood to the lungs for oxygen and the lungs return the oxygen-rich blood back. A well-oiled machine, isn't it? But in the case of a pulmonary shunt, this machine hits a glitch. For some reason, blood bypasses this crucial oxygenation stage in the lungs. Instead of going through the lungs' oxygen bar, it takes a detour, returning to the heart without enough oxygen. This means our organs, which rely on this oxygen to function effectively, might not get what they need. It's like trying to run a car without enough fuel. The engine will sputter and struggle, and so will our bodies. With this understanding, we can now delve into what causes a pulmonary shunt. What could possibly cause such a disruption in our body's harmony, you may ask? Well, the development of a pulmonary shunt can be traced back to a couple of key factors. One such factor is congenital heart diseases. From birth, some individuals have blood pathways in their hearts that allow non-oxygenated blood to mix with oxygenated blood. This mix-up can disrupt the normal flow of oxygenated blood, leading to a pulmonary shunt. On the other hand, lung problems also play a significant role. Conditions like pneumonia, pulmonary edema, or even acute respiratory distress syndrome can prevent blood from reaching those critical areas of the lungs where oxygenation happens. This means the blood returns to the heart without receiving enough oxygen, thereby creating a pulmonary shunt. So, whether it's a heart condition from birth or a lung problem acquired later in life, both can lead to the development of a pulmonary shunt. Now that we know what causes a pulmonary shunt, it's time to learn about its symptoms and how it's diagnosed. How can someone tell if they have a pulmonary shunt? Well, the symptoms can be quite varied. Some individuals may experience difficulty breathing, a common sign that the lungs aren't oxygenating the blood efficiently. Others may feel excessively tired, a result of the body's organs not receiving enough oxygen to function optimally. In more severe cases, there may even be cyanosis, a condition where the skin takes on a bluish tint due to a lack of oxygen in the bloodstream. This can be particularly noticeable on the lips and under the nails. Diagnosing a pulmonary shunt isn't a simple task of ticking off symptoms. It involves a combination of imaging studies to visualize the heart and lungs, lung function tests to measure how well the lungs are working, and blood oxygenation studies to determine the level of oxygen in the bloodstream. These intricate tests provide doctors a clear view of the condition, allowing them to pinpoint the cause and devise an appropriate treatment plan. After diagnosis, the next step is treatment and management. So how do we restore the harmony between the heart and lungs when a pulmonary shunt occurs? Well, the primary focus of treatment is to improve blood's oxygenation and manage underlying causes. Let's delve into what that means. To improve blood's oxygenation, oxygen therapy is often employed. This involves breathing in oxygen-rich air to increase the amount of oxygen in the blood. It's like giving blood an extra boost of oxygen to compensate for what it missed in the lungs. In cases where heart or lung conditions are causing the shunt, medications come into play. These can range from drugs that help the heart pump more effectively to medications that reduce inflammation or fluid buildup in the lungs. It's all about addressing the root of the problem. Now, in some situations, the shunt might be due to structural defects in the heart or lungs. These can often be corrected through surgical procedures. Yes, it sounds intimidating, but remember, surgical advancements today are extraordinary. These procedures can literally reroute blood flow or repair tissue, helping restore that vital oxygenation process. So as you see, medicine offers us a plethora of ways to manage a pulmonary shunt. It's not a one-size-fits-all approach, but rather a tailored plan to restore that essential harmony between our heart and lungs. With the right diagnosis and treatment, many can lead full and healthy lives. Remember, facing health challenges with knowledge and support can lead us back to the path of harmony and well-being.